Hey, my name is Brittany McDonald. I'm an Auburn University nurse practitioner student, and I just wanted to come to you and talk to you a little bit about pernicious anemia. Pernicious anemia is a condition where the body cannot create healthy red blood cells because it doesn't have enough vitamin B12. And vitamin B12 is a nutrient that the body absorbs through foods. And some people lack a special protein in their stomach called intrinsic factor, which helps absorb vitamin B12. And so it creates an inability for them to absorb it. And there's also some other conditions that can cause vitamin B12 deficiency. And some of them include infection, surgery, and sometimes people's diet can affect what they're actually able to absorb. Because if you're not taking in enough vitamin B12, then obviously you're going to have some issues with absorption. The people that are at most risk would be people from Northern European and African descent. A lot of times older people can be at more risk because their stomachs lack acid and the intrinsic factor. As you get older, you stop producing a lot of stomach acid. And then it can also occur in younger people and other populations. The highest risk people are those who have a family history, anyone who's had part of their stomach, all of their stomach, or part of their small bowel removed, because the small bowel is where a lot of that's absorbed. And then autoimmune disorders that involve any of the endocrine glands, like Addison's disease, type 1 diabetes, Graves' disease, or vitiligo. Those can cause vitamin B12 deficiencies. Any intestinal diseases that can prevent your body from absorbing vitamin B12, such as Crohn's disease, anything intestinal infections, or HIV. And then there's a lot of medications that can cause your body to not properly absorb vitamin B12. And some of those are antibiotics and certain seizure medicines. And if you're a strict vegetarian or have a poor diet, then you also won't be able to absorb as much vitamin B12, so you may be deficient. 3 important questions that you would want to ask a patient if you're working them up for pernicious anemia would be, first, what does your diet consist of? If they have a diet that is low in animal products, a strict vegan diet, or if a patient is, the mom is breastfeeding her child and she's vitamin B12 deficient, then that can all put the patient at risk for pernicious anemia. Another thing is that you want to ask them, have they have any recent abdominal surgeries, like a gastrectomy, a small bowel resection, any bariatric surgery. It can cause the body to not absorb vitamin B12 as much, so they would be deficient. And then also, what medications do you currently take? Metformin, histamine receptor antagonists, and then proton pump inhibitors, which are very common, all can cause vitamin B12 to not be absorbed in the body properly. When you perform a physical assessment on a patient who you're looking for pernicious anemia, you want to focus first on a neurological assessment. You can see ataxia, cognitive impairments, weakness, and then numbness in patients who have pernicious anemia. And then also you want to focus on inspecting the oral cavity. A lot of times they can have bleeding gums and glossitis, which is inflammation and reddening of the tongue. And it can be super sore for the patient. And so you'll notice that. And then the other assessment would be a cardiovascular assessment, because when you have pernicious anemia, sometimes the patients can have palpitations or tachycardia. And so you want to really pay close attention to your auscultation of their heart sounds. When you're educating a patient who has pernicious anemia, you want to focus on teaching them to increase dietary intake of meats, peas, beans, any protein-rich foods. You also want to teach them that most likely this is going to be a lifelong treatment. A lot of times these patients do end up having to be treated for vitamin B12 deficiency throughout their lifetime. So another thing that you would like to educate them on is how to give self-injections of vitamin B12, because if they're going to have to do this for a long time, then they may want to know how to do all that. Thank you so much, and y'all have a great day.